The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar, Medicare, How Safe Is It? Before we get started, I would like to go over a few items so you know how to participate in today's webinar. When you joined today's webinar, you selected to either join by telephone or computer audio. If for any reason you'd like to change your selection, do so by accessing your audio pane in the control panel. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send your questions in at any time, and we will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grant Makers in Aging and moderator for today's webinar. John?
Well, thank you, Kat, and I'm delighted that so many of you have joined us today. Before we begin, we want to thank West Health, whose support allows us to offer this webinar free of charge to our GIA members. We are trying to meet the need for up-to-date policy information for our members, and this week has been another one of those weeks where everything changes on a minute-to-minute, hour-to-hour basis. So we're particularly grateful that we're able to bring to you this month again another expert from here in Washington. And with us today is Brian Lindbergh. He's a Washington, D.C. based advocate, policy educator, and lobbyist. He serves as a public policy advisor to several organizations, including the National Association of Long-Term Care Ombudsman Programs, the Elder Justice Coalition, the Gerontological Society of America, and the National Association for Geriatric Education, and the Special Needs Alliance. Brian has also served on many boards and advisory panels, including the Institute of Medicine, Centers for Medicare and Medicaid Services, NAIC, and the Planning Committee for the National Quality Forum, appointed by Vice President Gore. Brian worked in Congress for 10 years on the House Select Committee on Aging and the Senate Special Committee on Aging, and he holds a Bachelor of Social Work degree from Temple University, a master's degree in the management of human services from Brandeis, and studied social and healthcare policy at the University of Stockholm's International Graduate Program. Today, Brian's going to be exploring a variety of issues affecting older adults as Congress attempts to complete its agenda before the end of the first session of the 115th Congress. As was mentioned, if you open the question box that's on your control panel, you can enter your questions, you can type in your questions at any point. Once Brian's finished his presentation, we will turn to those. So Brian, welcome, and let's get started. Tell us a little bit about, we're at 2 o'clock Eastern time on today, so where are we with Medicare and the rest of programs affecting older people?
Okay, well, thank you. Thanks, John, for including me in your webinar series, and thank you to your colleagues, Emily and Kat, who have been so helpful in preparing for today. Yes, my topic is Washington Update, an Aging Advocate's Perspective. And I don't want to ruin the punchline, but I did just see a text come across that the House has passed their tax bill, but I'm going to get to the details of that in just a moment. Let's go to my first slide. So you may wonder why I decided to, instead of just Washington Update or what's happening in Congress, why an advocate's perspective? And I want to say that I consider myself first and foremost an advocate. I'm a social worker by training with a Bachelor of Social Work, but I always had an interest in working at the macro level, that change the world kind of mentality. So I have carried that with me through my career, which is really focused on aging and healthcare policy, long-term care, Older Americans Act, community-based services kinds of work. One of my first jobs after graduate school was working on the Senate Special Committee on Aging, and then later on the House Select Committee on Aging. And what you need to know about those committees that's slightly different is that they're really, I consider them advocacy committees. Now, the House Select Committee is no longer there, but the Senate Special Committee on Aging, I'm sure you've heard about it. And you can go to their website and see some just absolutely wonderful hearings they've done on a lot of different aging issues. They are really like the conscience of Congress, pushing the other committees with legislative jurisdiction, which the Aging Committee doesn't have. It can cover everything. On the other hand, it can't pass a bill and move it on to the Senate floor like the other committees. So that committee holds the hearings, does the investigations, and pushes and advocates. And finally, one of the great pleasures that I've had over the years in working with my clients, and including my past work with the John A. Hartford Foundation's Geriatric Scholars and Change Agents programs, is developing advocacy training, helping people who have otherwise very busy lives, like all of you do, maybe doing aging research or teaching or being practitioners, or funding aging programs, teaching them, giving them the skills, the toolkits, so that they can expand their role and be an advocate as well, outside of their regular daily work lives. So let me go to the next slide and just say that timing is everything. I met my wife on the House Aging Committee back in 1987, and we had overlap of our jobs there. She was working for the Republican, I was working for the Democrat at the time, of about 2 months. And that 2 months has turned into, a long-term 30-plus year relationship. Well, timing is everything today, too, because we were going back and forth about dates for this particular webinar, and we were looking at several months worth of potential dates, and we finally chose this one. And as you may get from what John just said, today is probably one of the biggest legislative days for Congress, for this whole Congress, the 2-year Congress, and for the administration. The House votes today on their tax bill, which is a budget reconciliation bill, which I'll tell you about. And the Senate Finance Committee continues its votes on their tax bill today. These are 2 of the most important bills that will, if they pass, will be somehow merged together, and see if they can pass that. But this will change tax law and a lot of aging policy for decades to come. In fact, we probably shouldn't be doing the webinar. We should probably be watching C-SPAN right now, but you're stuck with me. So let's go to the next slide, and I'll tell you what I'm planning to cover today. I'm going to talk about the budget and appropriations process, tax reform, a few other miscellaneous pieces of legislation if we can fit them in, and then just to do something that's a little more future oriented and not what's happening right today, I want to talk a little bit about the Older Americans Act. So by way of background, let me tell you where we are right now. The fiscal year begins October 1. So the fiscal year appropriations, let's go to the next slide, please. The fiscal year 2017 appropriations ended September 30th. And of course, we weren't ready. Congress wasn't ready with the FY 2018 appropriations. So they did a continuing resolution, and that's what we're doing now. When we got to around February, that's when the president usually would send a budget up, but it was late because it was his first year, and they had a late start anyway, and so they did send up their budget, and it was basically rejected by both Republicans and Democrats. And interestingly enough, they did it very openly. They just said, we just disagree with most of what the president has proposed to cut and do here. Let's go to the next slide. Let me just say, here is just a little bit about the process. My dear friend Bill Benson always shows raw sausage and talks about sausage making being ugly. I prefer mine grilled, so I've got a stolen picture of grilled sausages there, but it is a mess. sometimes, and it rarely plays out exactly the same. But I'm going to talk to you about the basics, the budget reconciliation, appropriations, and then how we just go about and do it again the next year. So let's go to the next slide, which is the budget. So the president sends his budget up. As I mentioned, it's been ignored. Congress then has to pass its own budget. And in recent years, it's been pretty partisan. So the budget that just was passed very recently for fiscal year 2018 by both the House and the Senate was just Republicans supporting it. And in fact, some Republicans didn't, but they had certainly enough to pass the bill. So in this case, typically you have two bills and then they go to a conference committee and they discuss it and they work out the differences. What happened this time, the House passed their budget, they sent it to the Senate passed their budget with some modifications and sent it back to the House and basically said, take it or leave it, and the House agreed to that budget. That budget does not become law. It creates a legislative vehicle that we're going to call budget reconciliation. And you may recall last year, it was the budget reconciliation bill for FY 2017 that they used to try to repeal the ACA, Obamacare, as people call it. So that didn't happen, and that opportunity ran out at the end of the fiscal year, like I said, September 30th for FY 2017. So now we're in fiscal year 2018, and the budget reconciliation and all the work they want to do is around tax reform. So they passed their budget, which allows for up to $1.5 trillion in deficit increases over the next 10 years, and that's so that they can cut taxes. The budget also includes $473 billion in cuts to Medicare, $1 trillion in cuts to Medicaid, and $800 billion in cuts to non-defense discretionary spending. And so think about discretionary spending as two pots, defense and non-defense discretionary spending. There would be $800 billion cut out of non-defense discretionary spending, because Democrats and Republicans alike generally do not want to cut defense. They want to increase it. Some Democrats want to cut it, but most don't. So programs that are non-discretionary spending are the Older Americans Act and HRSA and public health and all sorts of programs like that, and other programs that could be cut under that possibility would be food stamps or what they call the SNAP program. And this may also lead to across-the-board cuts because there's a Budget Control Act that is in place where if Congress doesn't come up with appropriations levels that fall under the caps for spending, and they don't raise the caps, which they have some years, then they do across-the-board cuts. And that could lead to major cuts like in the Prevention and Public Health Fund. So that's the budget that both the House and the Senate passed. It's a blueprint. Let's go to the next slide, and I'm going to explain, before I get to budget reconciliation, I'm going to quickly explain appropriations. And this past year, during this last several months, we have had House and Senate work on appropriations bills. They went ahead and did this work even before the budget was passed, because you've got to decide how much all these different programs are. The one that we watch the most is the Labor, Health and Human Services, Education and Related Agencies budget. And while that includes many programs you know of, there's also 11 other subcommittees that deal with appropriations. So we didn't get our appropriations ready by October 1, so we have been functioning on a continuing resolution, which runs out on December 8, 2017. So not that long after they get back from the Thanksgiving recess, all of the government, in theory, would shut down unless they pass another continuing resolution, or sometimes they call it an omnibus appropriations bill where they put all of the bills together and move forward for the rest of the year. And as I mentioned, we're still functioning on those 2010 budget agreements and caps, which could lead to sequestration. Just a couple examples of what the appropriations committees did this year, and what the president would have liked to do. You can see there the list of programs that would be eliminated under the president's budget. The House did cut $100 million out of the Older Americans Act Community Service Employment Program. They took it from $400 million to $300 million. They took $4 million out of the Geriatric Workforce Enhancement Program, which trains healthcare professionals all across the country in what they call the GWEPs, and it trains caregivers as well. So there's a lot that needs to be done to come to agreement between the House bill and the Senate bill. I haven't given you a ton of details there because it's there's a lot of details to give. Generally speaking, most Older Americans programs were flat funded, but we are in a position where we could lose funding for the state health insurance programs, the SHIPs. We could lose money for the senior employment program, as I mentioned, and many others. This needs, in the Senate, you basically need to have 60 votes to get this final appropriations done, because otherwise folks could filibuster. They could say, no, we want to keep debating this and go on and on. So this will be, to some extent, a bipartisan bill eventually. Now let me jump to budget reconciliation, and that's what leads to tax reform, which is what's going on right now. So we have a budget that I mentioned. It's the blueprint. It gives instructions to the key committees to write language to implement the budget. That budget reconciliation package comes together in the House and the Senate as a piece of legislation, and it has special rules. When it's in the Senate, you only need a simple majority or 51 votes to pass a budget reconciliation bill. And that's what makes this so tricky. The Republicans have 52 members of the Senate. The Democrats have they have actually 46 plus 2 independents that usually vote with and caucus with the Democrats. So it's very close. They remember healthcare reform or repeal of Obamacare. They could not get the 51 votes they needed to pass it, including the vice president. Otherwise, they'd need 52, obviously. But if it was a tie, 50-50, the vice president could break the tie. So this year, we've got a two-step process. You can forget about appropriations now. That's just on a separate track. The first step is everything taxes, right? They are cutting taxes now. That's what the Senate Finance Committee is working on today. That's what the full House was working on today. The second part of this, in order to pay for some of the tax cuts and to reduce the deficit, will probably happen next year. And those will be cuts to entitlements or mandatory spending and the non-defense discretionary programs that I mentioned. They will actually go through this whole process again right away at the beginning of next year, next calendar year. This is in theory, but this is the way it'll probably work. If they can get this tax bill done now, next year they will try to quickly pass a fiscal year 2019 budget, and then next year's budget reconciliation will be all about reducing entitlements and discretionary spending. So let's go now to the next slide, which gives us a chance to talk about the current tax reform effort. As I mentioned, the bill allows them to spend or reduce revenue up to $1.5 trillion. Now remember, not to be too cynical here, but These are the deficit hawks who are doing this budget work, and they are supporting increasing the national debt by $1.5 trillion, at least. It'll actually be more if certain things play out, but that gets, it's the whole notion of trickle down, right? We're going to give corporate entities giant tax cuts, and we're going to give people giant tax cuts, although the individual tax cuts aren't giant. And that will give the business world money to buy equipment, expand their businesses, pay more wages, and all of that will lead to more tax revenue. And I'm not here to dispute that, but we have seen over the years, during the Reagan tax cuts and then the Bush 2 tax cuts, that the deficit did actually grow significantly from all that. The revenue, any additional revenue that came in did not make up for those tax cuts. So let me mention some key provisions in the bills, just to give you a flavor for it. They're very complicated bills, obviously hundreds of pages, but the bills vary in the House and the Senate, and that's going to be a challenge. You can make enough senators happy to vote for something, but then you're going to lose House members. They don't like the bill, so it'll go back and forth. But they're generally, they modify the tax brackets to lower taxes. They expand the child care credit. They double the standard deduction, and they lower the corporate tax rate to 20% from 35%. So that's a big jump or drop. They repeal a number of things like flexible spending accounts, which you may know about, deductions for student loans, the interest on those, tuition. The state and local tax deduction is eliminated in the House, and the medical expense deduction is eliminated in the House. And there's a number of other deductions that are eliminated in order to simplify the tax code. And they modified the mortgage insurance deduction slightly, but they don't get rid of it. So let's go to the next slide, and I'm just going to try and make this seem a little more real for, well, maybe let's go back to the last slide, because I don't want to have you looking at that, because I have some other, thank you. Let me make this a little more real for aging and individuals with disabilities. The House bill, as I mentioned, eliminates the tax deduction, which is vital to Americans with extremely high medical costs. So what does that mean for us? Well, it means, if you spend a ton of money on health care, you may have multiple chronic illnesses, you may have a disability. Those deductions go now to almost 9 million households. And if you think about it, a lot of those individuals are people with long-term care needs. So the House bill eliminates that. So that's a real significant problem. It also eliminates an incentive for businesses to hire people with disabilities. It's the work opportunity tax credit. It eliminates the bills eliminate the orphan drug tax credit, which we think would really decrease the likelihood that pharmaceutical companies would invest in research that addresses rare diseases, and older Americans and individuals with disabilities are those more likely to have those diseases. It eliminates another tax credit for small businesses who would try to make their businesses accessible for employees with disabilities. There are some reductions in incentives for charitable giving, which, as we all know, many of those organizations out there that serve older adults are charitable organizations. We do think that it will have a ripple effect and squeeze state and local budgets, particularly, of course, if the proposal to eliminate the deduction for state and local income taxes isn't approved in the final version. That's a deduction people can take in their federal taxes that they would be losing. So those are some of the issues. Let me mention now what just came as a somewhat of a surprise. On Tuesday evening, in the Senate bill, they added a repeal of the Obamacare or ACA's individual mandate, the requirement that most people have to enroll in an insurance, health insurance program, some sort of coverage. They have options. Usually, if they don't enroll, then they have to pay a penalty. The CBO has already estimated that this will increase the uninsured by 13 million people. It'll raise insurance premiums in the individual marketplace by at least 10%. A lot of those folks who would be affected would be the 54, 55 to 64 year old range, where individuals start having health issues and insurance could go way up for them, and they're in the marketplace now. But it does add more than $300 billion in revenue that they can use in this tax bill for additional tax cuts. So if you think about the 1.5 trillion they're allowed to deficit spend, and then you think about this is another 300 billion they can do in tax cuts. And I failed to mention, by the way, that there are significant changes in either elimination or raising significantly the estate tax. So, you know, a lot of the argument that some of the advocates have is, you know, you're not helping the low and middle income, you're hurting older people, and why are you eliminating the estate tax for the top? It's not even the top 1%. It's a higher. It's a smaller amount of individuals that benefit from that change than anything. The other thing is that it basically throws out the notion that Senators Alexander from Tennessee and Murray from Washington worked out to stabilize the market over the last several months. They have 24 senators supporting their proposal, which would help continue to subsidize the insurance industry to keep their rates low for low-income people who can't afford to pay the premiums and co-pays otherwise. So it really throws that whole agreement up in the air. There's some talk that the Senate would pass the tax bill and then immediately turn to that agreement. But of course, the Democrats think it's counterintuitive. Why are you trying to stabilize the market with the Alexander-Murray agreement? At the same time, you've just taken away the individual mandate, which, as I mentioned, will throw the market in turmoil, and at least 13 million people will end up without insurance. Let me close this section by saying, so that is the budget, appropriations, budget reconciliation, and tax reform. And you can see, I hope, at least vaguely, how they all fit together. Now, the House, as I was saying at the beginning, I believe I got a text, but I'm afraid to go look at it while I'm on the phone with you, but I believe that the House has passed their tax bill today, and the Senate will finish either today or tomorrow in the Finance Committee. That Finance Committee draft will be turned into legislative language and will go to the Senate floor, we're told, shortly after Thanksgiving. So that could be in just a couple weeks. Now, let me go to a couple other items. Let me go to the next slide, which I accidentally went to earlier. There we go. These are just a couple programs I want to put on your radar screen: the Children's Health Insurance Program, CHIP, and the Community Health Center funding. This, we have an agreement in the Senate on that bill. The Senate agreement does not include how to pay for that bill, unfortunately. So it hasn't moved forward yet. The House has moved a bill it turned into a major squabble between the leaders of the Energy and Commerce Committee that wrote the bill, the Republicans and Democrats. The Democrats don't like the way they paid for these programs to be reauthorized. The reauthorization ran out in September. So that bill went to the floor and passed on a partisan vote nonetheless. And so keep watching that, but that's a program that we really need to get done so that the children's health insurance programs don't run out of money. I've got a letter here for you. I'm not going to spend any time on this, but I want to call to your attention the good work of one of our colleagues at the National Council on Aging, because there are a lot of pieces of legislation that make up the Medicare world and the programs that support older adults. And they include therapy caps and the programs that provide resources for Medicare low-income outreach and enrollment. You may know about the Money Follows the Person program. All of these programs are part of what you call the home and community-based services network and linkages, if you will, with Medicare. And I just want to call those to your attention. We really need to get those done as soon as possible. There was good news this week. Just yesterday, the House Ways and Means Committee came to a bipartisan agreement, if you can believe it, on extending a number of Medicare pieces, and a couple of them there'll be a permanent extension of the exceptions process for Medicare with the repeal of the therapy caps, which is a good thing. There's a 2-year straight extension of the Medicare Geographic Payment Index for physician payments. So those are just a couple examples. There's a 5-year reauthorization of the special needs plans under the Ways and Means bill. These are all things that need to get done. They're important. The average lobbyist, let alone the average American, doesn't know that there are all these little pieces that need to be extended or reauthorized, if you will, every few years. And it looks like, at least on the House side, we're moving in a positive way there. Let me go to my next slide, which is Medicaid. And I won't say much more about this because I hope you got the gist of the budget reconciliation discussion, and that Medicaid, which, as you know, this is just one piece of data, but I mean, I just put a piece of data there because it's Medicaid is so critically important to older persons with long-term care needs, individuals with disabilities. I'm sorry, if I said Medicare, I meant Medicaid. And the Medicaid program has been under attack. If you followed the repeal and replace effort, you know that they were both attacking all of the expansion of Medicaid, which some states bought into and have been taking that money, and that's why governors from Ohio and a number of other states who are Republicans were saying, no, don't stop the expansion money. And they're also going at the core funding. There's a couple ways that we're going to see it continue through proposals to block grant or per capita cap that's limiting, by person how much a state will get, depending on what category the individual falls into, younger person, disabled, older person, etc. And these are ways for the federal government basically to limit the amount they put into Medicaid, which is an entitlement, and it's in an agreement with the states. It's a collaboration. So if the federal government cuts back what it will do, that means the states will be stuck with footing the bill as Medicaid grows over the years, and that's a real problem. States have budget limitations. They can't deficit spend, and so they will have to change the benefits that are provided, and that means long-term care benefits, or they will just have to raise additional revenue to pay for all that, and we know that states don't do that. The key here is to remember that, as I mentioned before, the FY 2019 budget and budget reconciliation will, under the guise of deficit reduction, oh my gosh, we've got the deficit's going through the roof, look at the projections we just created by passing the tax reform bill, they will go after Medicaid full throttle. So let me jump now to my issue of and my next slide, the future of the Older Americans Act. And I'll cover it in three ways. One is the budget and tax cuts, very briefly, the reauthorization and pressure on Medicare and Medicaid spending. How does that actually improve the Older Americans Act standing? And so I've covered the budget piece. So let's see. Let me see what my next slide is. Sorry, I got lost there. Can you show me my next slide? Okay, go back one. Thank you. I'm just going to stay on this one for a while here. So with the budget and the Older Americans Act, I've pretty much said it all. But the bottom line is that all of the pressure that is going to be on Medicaid and Medicare and mandatory programs is also going to be on the budget, the discretionary spending, and that means the Older Americans Act as well. And the 1.5 trillion in debt, trust me, they will not be taking the money out of defense to make up for this, so they'll be looking at all the programs that we care about. That pressure will continue. The subcommittee that I mentioned before is the one that you really need to pay attention to next year, and that is the Labor, Health, and Human Services Education Related Agencies Subcommittee of the Appropriations Committee. They will probably get a very low allocation, and then there will be a battle between the Democrats and the Republicans to save some money for the Older Americans Act and other programs. The next piece of all of this is maybe a little odd to bring up, but it's the reauthorization of the Older Americans Act. Many of you may know we just finished the reauthorization last year, 2016, and the current law goes through 2019. And at first I thought, well, why should I, talk about this? But then I realized it may be odd to be bringing it up now, but then one of the pitfalls of being, a Washington policy advisor and lobbyist is we often fail to look ahead, because we're so concerned with, the issues of the moment, the vote on the tax bill today, and all the distractions of the current crises that we don't start looking ahead. So my view is, why don't we start looking ahead now? It's only a 3-year reauthorization. The funding in the authorization bill is very modest. It's basically current funding plus 1% or so each year. So where should we start? The proposals from the last reauthorization process were extensive, and Senator Sanders, who is the presidential candidate probably more than the chair of the subcommittee or the ranking Democrat on the subcommittee with jurisdiction for the Older Americans Act, got a lot of organizations putting their heads together to come up with fabulous proposals for the Older Americans Act, many of which, because of politics, were never implemented. So my suggestion is we should start the process now to dust off the proposals from last time and see which were dealt with, which weren't, and which still would make the Older Americans Act a better bill, a better law, would help facilitate the aging network, which is made up of the state units on aging in each state and all the area agencies on aging, and then all those service providers, nutrition providers, senior centers, and all that, the long-term care ombudsman program. What could we find from what we've already done that would strengthen those in the future? New ideas, innovation, yes, we should think anew, but let's not reinvent everything as we move forward. So thinking about some of the things that need to happen and the key players, Assistant Secretary Lance Robertson of the Administration on Aging considers this probably what will be his biggest initiative over the next few years. He said that. He says it's a key priority. He agrees actually that there's been great work done last time. He was a state unit director at the time, and I think he probably wants to dust off some of his own ideas, and why not start there? He sees engagement around the Hill as critical. I interviewed him recently for the Gerontological Society of America's newsletter. I do a monthly column there, and he talked about the need to show the value and the efficiency and the effectiveness of these programs, that the Hill really needs to hear more about the value of these programs. Some of them don't even realize that these are programs serving their constituents on a daily basis. And that's all about getting our story out. And he pledges to get out to the states and the communities and hear what the network thinks would be the likely changes. With regard to other players, the advocacy organizations will need to decide pretty early on whether they're going to try and push the envelope and really make change, or just try to hang on to what you've got, standing pat with the current law. I think part of the interesting environment that we're approaching will be whether the Senate and the House make a change after these next midterm elections in 2018. That could considerably influence how the area agencies on aging and other key aging advocacy groups, AARP and others, look at whether they just hope to get the thing reauthorized almost as it is, or if they really want to make some major changes. Sometimes when you bring up major changes, it makes certain parts of the act vulnerable, and one has to look at the political consequences of all of that. Let me try and wrap up here. I'm running a little behind. So I do think, though, Congress is going to be key, and we need to make the process bipartisan earlier this time. Last time, the bill that got introduced early on was a great bill, but it really became a Democratic bill, not a bipartisan bill. So we should start very early and work with both sides of the aisle to look at what we can do in this upcoming process. And finally, my bullet on pressure on Medicare and Medicaid spending. Can we look at this as improving the Older Americans Act standing? We have observed, and many have participated, I would say, in adapting to the evolution of the aging network with the growth of Medicaid managed long-term care. So with managed care organizations out there providing a lot of supportive services and being responsible for long-term care, and obviously wanting to avoid expensive nursing home care, we have seen the aging network evolving. Sometimes in some areas very quickly and adapting nicely, and in other cases not so much. So I think we need to think, and the Administration on Aging is thinking in terms of their role in community-based services and working with CMS, connecting so that the Aging Network in a way is in a position to be a successful business partner, if you will, down the road. It's almost, is it the business case for the Aging Network, or is it really the business case and a partial bailout, if you will, for Medicare and Medicaid? Because if we're there as an Aging Network for Medicare and Medicaid, that means many individuals may end up with reduced unnecessary hospitalizations. We keep them in the community longer. We save those programs a good bit of resources. Let me cover one more issue and then I'll open it up for Q&A. Help for the family caregiver through the Aging Network's supports and services, I think, is critical. Critical, obviously, for family caregivers and their loved ones, but also, as I mentioned, Medicare and Medicaid, and they rely on the significant unpaid caregiver supports and services that are out there doing the heavy lifting. So I think we really need in this reauthorization to continue to make the case for the family caregiver and the support that the Aging Network can provide to those family caregivers. Let me close out this legislative piece by mentioning a bill that actually could become law this year. I think we also need to consider how the Raise the Family Caregivers Act, it's S1028, works in our favor as Older Americans Act advocates. This bill has passed the Senate. It's a bill that would direct the Department of HHS to develop, maintain, and update a national family caregiver strategy, which I think we desperately need. And it would convene a group of real people and experts called the Family Caregiver Advisory Council to advise the Secretary on recognizing and supporting family caregivers. I'm very hopeful this bill passes. The House version is HR 3759, and I can get that information to John. But this would be a small step this year, but it would be a powerful step just to get the administration basically to commit to that important program. So with the Older Americans Act, we need to fight for adequate funding. We need to start thinking about reauthorization now and reinventing the Aging Network and remembering the importance of family caregivers. And if you could go to my last slide there. Well, it's not actually my last slide, but it's close. I just want to thank you for what you do. We're all advocates in different ways, with older adults as our North Star. And it's been a pleasure being invited today. And if, my next slide, please, if in case you'd like to advocate more, my next slide shows you the Families USA action alert that they sent out just yesterday. And there's a web link, and it tells you if you want to get involved or if you want to share this with others, how one could communicate to the Senate that the repeal of the individual mandate and increasing the deficits will hurt programs for those who need them desperately. So with that, I go to my last slide.
Well, thank you so much. Well, thank you so much, Brian. Certainly very sobering comments. And yes, it is true that the House passed its bill while we were here. Uh, so a couple of questions for you. First one is a $900 billion cut in Medicaid would be devastating. How do you, as an advocate, try to make people understand the scope of that change? And then there's the second part of the question, which is there actually a possibility in the next 2 years that when you say that they're going to come after Medicaid, that they may try to, in fact, eliminate Medicaid in its entirety?
Okay. Well, it's a good question. It's a difficult question, and the number that you quoted is probably one of the lower numbers. I think that some of the advocacy groups think it's going to be, the cuts could easily be, if they implement the bills as they've been written, more than $1 trillion. But I think the bottom line, John, is that in 1965 and subsequently, of course, but starting in 1965, we passed several bills, the Medicare, Medicaid, the Older Americans Act. Those three are just the bedrock. They are the core of the notion that older adults and low-income individuals should have access to health care, and with the Older Americans Act, supportive services and such. And Medicare and Medicaid, of course, are entitlements. So we, as the need grows, we need to spend more money. When the economy goes down, more people end up on Medicaid. They lose their jobs. They don't have insurance. They apply and may receive Medicaid because of their income. So these are entitlements, and I would argue that if you look at Speaker Ryan's proposals over the years that are well circulated and such, and other proposals by others who would like to reform these two programs, we are really talking about retreating from being an entitlement with a set, established, organized set of benefits. And as the Obama administration and the Clinton administration unsuccessfully, and other administrations in the past have tried to ensure that everyone had access to a certain package of benefits, we have grown to ignore the fact that we have Medicare and Medicaid, which really does, they aren't perfect, but boy, they cover people, they give them care, and actually they save a lot of money, because if those people didn't have care and they all waited longer, the expenses, as we know, and that's why we have tried to move away from taking care of people in emergency rooms as their primary care docs. We know that it's not an effective or efficient way. So I really do believe we will have this question will be right in front of us next year. Are we going to retreat on these entitlements? I think the positive signal is what happened with the failed repeal of Obamacare, and that is people actually, and I actually want to give some members who voted for it more credit than they get. I don't think a lot of them wanted to vote for the drastic cuts to Medicaid and taking people off insurance, but it became a political thing, and of course that's you have to make your judgment on that. But we had enough who said no, so I thought that was an amazing two things. One, it was amazing what advocates did, and it was courageous what John McCain and Susan Collins and Lisa Murkowski and others on other versions of the bill did to stop it from happening. It's just too bad that they can't let go of that, the Republican let go to that political issue and just go to work to come up with a compromise on fixing the system. But I don't think that eliminating Medicaid is possible in the near future. I don't want to exaggerate because it could certainly take terrible cuts, but I don't think there's the political will there to do it now. And I actually believe that if they did that, if they moved in that way, it could shift politics and we could see a different Senate the next year.
Well, thank you for that. I'm going to ask you one other quick one, and then we'll turn to your final comments to our audience. So our audience today is made up entirely of people who work in philanthropy and aging, primarily from foundations and corporate giving programs. Do you have any advice for the philanthropic community as we go through this very complicated and bewildering process sometimes for those of us who have a strong interest in making sure that the needs of older people are protected during this process?
Yeah, that's a tough question. You know, what comes to mind though is I work a lot with individuals who are cutting edge researchers in the aging world, educators in the aging world, practitioners, folks who are always trying to be relevant, if you will. And that's what comes to mind. I think the challenge for those of you who I'm kind of envious of you in a way that you're in a position to provide support to great programs and innovations and all that. I mean, it's got to be a lot of fun, but I think the challenge is to be able to be relevant. So I would say one thing is, you know, stay linked up. I'm going to give you a plug here, John. Stay linked really closely with John and his associates in Washington and state governments and such, because knowing what's coming down the road, even if you take, you know, my example of the Older Americans Act, you know, maybe you think, you know, if I want to be relevant, I should be thinking about now what we could support related to reauthorization of the Older Americans Act. That's an easy example. Researchers are doing the same thing. You could be working on a research project out there right now that just is going to be, by the time you're done, you know, we will have moved on, you know. But if you were working on, you know, the opioid issue a couple years ago, you might have been in the position to weigh in some of the major legislation that's been moving in Congress around addressing the opioid crisis. And of course, that's going to be with us for some time. So there's plenty still to do in that area, that space. So I would say, to the extent that you can stay in touch with people like John, to the extent that you can link up with, in the areas that you are priorities for your foundation, link up with newsletters that relate to those issue areas, so you see what people are talking about in policy, maybe at the state level, but definitely at the federal level. That's the one thing I would say is both the challenge, but also, I guess, really rewarding if you have provided resources or advice or counsel to people who end up coming up with some of the very needed cutting edge information that can be used in upcoming policy discussions here in Washington. And there's a lot of think tanks and others here in DC that you can track, and that might be helpful as well.
Well, that's going to be our final word today. I want to thank Brian Lindbergh for his participation in today's program. We thank you for all you do for older adults, and particularly at this very complex and difficult juncture. We also want to thank West Health for their support of this webinar series and allowing us to bring it to you free of charge. We will be making a recording of this interview available for our members. Please watch for a members only email to be sent to you later with the rebroadcast link. And finally, I want to thank all of you for participating in today's webinar. Have a great day.